So thank you for joining us for today's listening session. This is the second virtual listening session held by members of the Board of County Commissioners during the ongoing COVID-19 pandemic. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating the public comments for today's meeting. If any attendees here would like to go ahead and provide a comment or ask a question, you will be prompted to do so in a few minutes by me, and you can do that by utilizing the raise hand feature on Zoom. Your raise hand button is on the Zoom bar that's at the top or bottom, depending on your device. And if you're calling on the phone, and I see we do have 2 phone call listeners right now, and we've got 51 total attendees, and that number keeps going up. I think it took about 5 minutes for us to reach about 100 attendees earlier this week, so that's great. You can hit *9 if you're on the phone to go ahead and let me know that you do want to ask a question. And I'll go through these again in a few minutes. Today's topic is sheltering. Commissioners want to hear your concerns about sheltering in the midst and wake of the coronavirus pandemic. We have Clackamas County Commissioners Sonya Fischer and Ken Humberston joining us today, as well as a few county staffers. Right now we have Vahid Brown on from Health, Housing, and Human Services. And I just got word from Rich Swift that he will join us when he can. But Jill Smith is also going to join. Let me see if she is here yet. Yes, I do see Jill, so I'm going to promote her, and then she joins in a second. So great. Okay, today's listening session will go until about 3 o'clock or until we run out of comments, so whichever comes first. The session will be archived to YouTube probably by the end of the day. And with that, we're going to get started. So I'd like to go ahead and introduce Commissioner Sonya Fischer. Commissioner Fischer, if you would like to make any introductory comments you have.
Thank you, Dylan. Thank you, everyone, for joining us today. During this ongoing time of the coronavirus pandemic and its overwhelming effects on our ways of life, the Board of Clackamas County Commissioners has prioritized staying directly connected with each of our residents and stakeholders. Last week, we held our first, actually it was earlier this week, we held our first, last week we held our first virtual business meeting over Zoom, and we invite you all to join these sessions. We always want to hear our public comment. You can also find out more about those visiting on the board's webpage at www.clackamas.us. To stay as connected as possible, today we are holding a virtual listening session. We held another listening session that Commissioner Paul Savas and Commissioner Schrader hosted earlier in the week, and it was an excellent way to hear from our stakeholders in our community. Today we are talking about sheltering. In order to stay safe and stay healthy as a community, every person must have reliable, safe sheltering during this trying time. This becomes even more significant when we look at the challenges of how the virus spreads and compromised populations that may not have a place to self-quarantine safely if they're sick but don't need hospitalization. But what we want to know is what people are worried about during this challenging time, what they're concerned about, if it's involving themselves or friends or family, or just as a community, how do we support each other during this time? So the point of today's conversation is for Commissioner Humberston and I to hear directly from all of you, your opinions, personal experiences as it relates to this pandemic or in the wake of it. We are going to take what we hear to the full Board of County Commissioners as we take action to help our community. We're going to try to get through as many comments as possible, but we may respond to some. We've asked 3 individuals from our Health, Housing, and Human Services to join us today: Rich Swift, Deputy Director Jill Smith, and Housing Policy Coordinator Vahid Brown. And with that, I'll pass it on to Commissioner Humberston.
Thank you, Commissioner Fischer. I don't have a lot to add to what you said. I would just like to remind people that because Clackamas County was basically first out of the gate to make sure that we declared an emergency and encouraged people to manage their social distances, wash hands, and take the other precautions that have been recommended. If you take a look at our situation stats reports, you'll see that Clackamas County, compared to our neighbors, is doing considerably better, and we'd like to keep it that way. So I encourage everybody to make sure you keep good social distance, wash your hands, cover your mouth, do all of those basic precautions that you can to keep yourselves and your loved ones and your neighbors and friends healthy. And with that, we're here to listen to your concerns. I can tell you that there are staff that will be taking notes on our behalf so that your questions will get answered if they don't get answered today. And back to you, Dylan.
All right, great. Thank you very much, both commissioners. And this is the right time for members of the public. If you have a comment or a question to ask, the commissioners are very interested in hearing them. So if you would like to provide a comment, you can do so now by utilizing the raise hand feature on Zoom. And again, that is going to be at the top or bottom of the Zoom bar, depending on your device. And for those who are on the phone, and we have 8 total phone call-in listeners, you can indicate so by going ahead and hitting *9. Again, on the phone, that is *9, and it lets us know that you want to go ahead and make a comment. So we have some comments right away. The first, it looks like, is from Melissa Earlbaum. Melissa, let me go ahead and move you over. And then I think you have to unmute yourself, Melissa, and now you are on with the commissioners, so please go ahead.
Excellent. Thank you for the time. So I just wanted to share that we're having good experiences with the hotels in terms of them accepting survivors of violence that need to get into a safe location. But one of my concerns is that because the hotels are struggling to keep their doors open, what might the county consider doing to help them? What we see is that we're seeing an increase in calls, but I know that there's going to be truly a surge in calls a couple of weeks from now. And my concern is, will the hotels still be open at that time? Do they have enough resources to stay open when that hits?
And Melissa, just for the purpose of the audience, do you mind identifying yourself and your role? Just because I know who you are, but they might.
Yeah, sure. Melissa Earlbaum, Executive Director for Clackamas Women's Services.
Very good, thanks. Great. Commissioner, should I move on to the next, or do one of you want to?
So just a comment, I know that we've been anticipating that this might be a challenge, and I don't know if Vahid, you have any more current updates. Nancy Bush continues to update us that they are looking ahead at this being an issue, and they know that there are things in the works, but I don't know if there's anything publicly that we can talk about today, or if there's anything more substantive as we prepare for what we expect to be more need in the community.
Well, I can just say that, yes, the Emergency Operations Center and its command leadership, Nancy Bush and colleagues, are continuing to focus on the need to maintain access to motel rooms. Our effort to place vulnerable people experiencing homelessness in motel rooms has been similar to what Melissa reports. We're successfully able to place people as we get referrals, and that's been really positive. There was a motel closure early on in the crisis in Tualatin that I think let us all know this could be a challenge. The industry, of course, is facing economic losses because of widespread loss of business. But we're working with the Emergency Operations Center to gain access to motels in a variety of ways. But the concrete, specific next steps are still kind of being worked out.
Commissioner?
Yeah, I know at least 2 of our local hotels here in Clackamas County are working with EOC and have agreed to place people with vouchers from Clackamas County. The last report that I had was that everyone who was had requested a voucher so that they could get placement in a hotel or motel had received them. And that report was either yesterday or the day before. I haven't gotten any reports since then, but I really want to commend the hotel industry for working with us on this.
Excellent. Okay. Thank you very much for that. And thank you for the call, Melissa. Okay. The next one we have is from Dylan C. So Dylan C, just give me a second here. And you need to unmute yourself, Dylan C. There you go. And you are on with, if you could give your area of residence and your name
Thank you. My name is Dylan Cromarty. I'm a case worker at Northwest Housing Alternatives. I work in the mental health focused area there. I have about 30 clients who I provide case management to, and I'm actually reaching out on behalf of other staff members that weren't able to make it. But the question that I have are more of a statement to begin. Is the worry about 6 months down the line when this is all over and rent is due. It's very easy to see how 6 months down the line, people may not have recovered, and there may be a slew of evictions that will overwhelm, for example, the family shelter that Northwest Housing has. Are there any comments on thoughts about what might come at 6 months?
So I'll just comment and say your comment is exactly why we're having these listening sessions, because we need to be thinking 3 months, 6 months, 8 months, 9 months, a year. And so thank you for that, because that's going to be a tremendous challenge. And we do need to be planning ahead.
So there was a release from the governor's office today regarding some of that. There's a coronavirus economic advisory council that you can contact. There is also a Consumer Finance Protection Bureau guide to mortgage relief options related to coronavirus, and a guidance to Oregon lenders, to name a couple of 3 places that you can go. And also the Oregon Housing and Community Resources COVID-19 resources page. So there are resources out there looking at this question, both in the immediate moment and towards the future. What I would say is that anybody that has found themselves in a position of not being able to pay their rent or their mortgage at this particular time, reach out to either your landlord or your mortgage company now. Make arrangements in advance so that you don't face that eviction problem 6 months from now. Waiting until it's been done, so to speak, and you're 6 months behind and you've made no arrangements is not going to help you.
I think I also saw both Jill and Vahid put their hands up. Jill, why don't we go to you, since I think you had your hand up first.
Yeah, I've been on national and local calls. This is a very well-known problem and something people are anticipating and planning for. There's substantial federal funding coming in for things like vouchers and rent assistance. And I think we're going to have to prioritize it to deal with this situation. That's the discussion that's happening. Make sure that we prioritize new funding to deal with what we know is coming.
Next, we're going to go to Debra Mason. So Debra, just 1 second. And then if you can unmute yourself, Debra, and you are on. If you could give your area of residence, thanks very much.
Hi, thank you. This is Debra Mason from the Clackamas Service Center. And of course, we're thinking a lot about food insecurity and the fact that folks need to stay at home to stay safe and to flatten the curve. We've switched to a delivery service for our members, but we are really hand-tied by how much work we can actually produce in a given day because of keeping safe distance from each other. So we are serving between 30 and 50 households per day, getting deliveries out to them, which is great, but it's not nearly enough. And so food delivery is going to be really key for any efforts out there for food. I know the county is moving on this pretty quickly to get some food out there, but I think that being able to provide delivery is going to be extremely key. And we also are really needing some help getting food to our unhoused members. They're not as easy to serve as you can imagine without addresses. And so being able to keep people where they're at, so if they are currently camping, to eliminate sweeps right now would be really helpful, because once we can find people, but if they get moved around, we're going to lose them, and they're not going to be able to shelter in place like they're being ordered to do, and get the basic needs that they need that we're able to get to them. So that's a concern of ours right now as well.
Commissioner Fischer, I couldn't tell if you were going to say something there. Sorry.
Oh, I want to ask Debra. Debra, what are you hearing out there? Are you hearing that sweeps are happening right now?
Yeah, I think that they are continuing to happen. I think they probably slowed down, but I just got a report out from one point of contact, which is Multnomah County, but that affects folks that we serve here in Clackamas County quite a bit. So that's still happening. So, you know, we're working with a lot of different people to get a lot of tents out there. So people, if they are experiencing symptoms, can choose to sleep alone or sleep separately, which is helpful, but continuing to move people around is just really counter to everybody's health and well-being right now.
Okay, I really appreciate that. I had heard one report of the people being moved around, and our emergency operations center got in touch with the jurisdiction to try to put a stop to it. So if you know of other situations, if you could let us know so that we can follow up with either the city managers, I mean, whoever is a law enforcement entity.
Absolutely. And I guess I could add too, for us specifically at the center, we know the demand that we're under normal circumstances, with the amount of people that are unemployed now, being pushed to a situation where they've never needed our services before. I can't imagine what the demand's going to be as we sort of proceed through this crisis and come out of it. I think the crisis for quite a few people is going to continue for at least a year or more. And so I know that we're going to be needing a lot more help to do the job that we want to do.
Well, thank you very much, Debra. Okay. Next, we're going to go to someone on the phone. I'm not going to reveal, and I don't have the entire phone number. I will just say it starts with 503-816. So 503-816, if you are there, if you could please provide your name and your area.
Hi, this is Rose Fuller from Northwest Family Services.
Yep.
And let's see, not to be redundant of what's been said, we do have staff that are taking all kinds of precautions and they're delivering about 30 food boxes a day. We're also the fiscal agent for the Gladstone Food Pantry. And in about 45 minutes, we're going to have our first drive-through through the senior center, and we're going to see how that's going to work. We had about 100 food boxes put together, so it's taken us a while to get that coordinated. You know, one of the things, there's a ton of needs, but one of the things that we have the culturally specific DV shelter, and we don't have funds to put people into hotels. Currently, we're full. We're not taking new people. So we're not quite sure what to do in terms of what to do next, because we don't have the option to put people in hotels. And this is dealing with the immigrant and refugee community. So I don't know if there's any suggestions on that. The other thing that we've encountered is that, especially when you're talking about the homeless or those who are very vulnerable and poor, is the cost of just to stay connected with them. They need a phone and phone service. And we have been working with T-Mobile on that. And they have come up with a plan, and it would be $300 per person per year, including the phone and service. But there, I mean, you know, when you're talking about connecting with people, if there's not a way to communicate, and I know our staff are working with hundreds of people, staying connected with them, making sure they're safe, looking into what kind of resources they need. So I've talked about a couple of things. One is, you know, what we're observing. Well, the other thing is there's shortages of such things like specialty formula and that kind of thing, which is critical for infants. And we're trying as best we can to get as many resources as possible. But in terms of two big needs, if I'll say that haven't been already mentioned, is getting phones and phone service to the homeless population so that, and those who cannot afford them, so that we can so all of us can stay in contact with them without being mindful of the safety of our own staff. And what, for those of us who provide shelters, do we do in terms of the community we serve, in terms of sheltering them, other than bringing them in, because we don't have the option of hotel vouchers.
Okay. What's that?
Hello?
Yes, we're here. Thanks very much for that. Okay.
Yes, thank you.
Very good. No, thank you very much. We appreciate that. Commissioners, we're going to try to get to a lot more people. I see we have over 70 attendees now and 9 people waiting to go ahead and make a comment. So I'm going to try to go through these. The next one, Simon Fulford. Simon Fulford, just bear with me for a second and let's have it go over. Not going over for some reason. We will go to the next person, Simon. I will try to come back to you, Abigail Wells. Okay, Abigail Wells, if you could go ahead and unmute yourself. Great, and now you are on with the commissioners. If you could give your area of residence or where you're calling from, please. Thank you.
Hi, I'm also with Northwest Family Services. I'm the Prevention and Community Public Health Department Manager. And there's a couple additional things I just wanted to bring to the attention of the commissioners. And that is in regards to the communities that are in the juvenile justice system that are being released, as well as recovery housing that can no longer take in people, and also treatment facilities. So there's a lot of people that typically would have shelter during these times that are not able to access it. So we are just we're actually working closely with public health, but keeping in mind things like naloxone and other needs that those communities will have, as it's kind of a perfect storm for relapse and problems with, continued recovery. And that's amongst also populations that are currently in recovery, just with the lack of supports, and communities that are not able to connect via Zoom or telecommuting. And as Rose mentioned, we're really, staff are kind of having to change what we do here and do our current jobs. So changing programs and supports so that they're accessible via Zoom, and looking at new and innovative ways to do things, while also having to address the immediate needs of our clients and people that we work with. So any support that can be given in regards to staffing or funding or materials, and just keeping that in mind as we move forward, that the nonprofits that are on the front lines are really going to need some additional support during this time. And we really thank you guys for hosting this session and listening to us all.
Great. Thank you so much, Abigail. I appreciate that. Commissioner Fischer, I'm sorry, I did not see that you had raised your hand at the end of the last question. Was there something that you wanted to add now? My apologies for that. Oh, you're still on mute, though. You have to unmute yourself.
Thank you. I just wanted to respond to Rose, because I'm expecting that she's anticipating if somebody becomes COVID positive in their domestic violence shelter. So if that happens, reach out to the Emergency Operations Center and let's connect that way. That is how we are managing things, is through the Operations Center, and to see what we can do to assist with that.
All right. Thank you very much for that. My apologies. And Commissioner Fischer or Humberston, if I miss your hand being up, please cut in and interrupt me. I am not the, Commissioner Humberston. Okay, very good. Very good. All right. Yep.
Throughout this broadcast, periodically, would you also let people know what the Emergency Operations Center phone number is? Because that is where you call if you are looking for help. and they can then direct people in the right direction. And I don't happen to have it in front of me, so.
I have it in front of me, Commissioner. And everybody can get this from the coronavirus page the Clackamas County has set up. That is clackamas.us/coronavirus. The call center is 503-742-5300. Again, 503-742-5300. Again, you can get that at any time from clackamas.us/coronavirus. So thank you very much, Abigail. We will go on to the next person. I think that Simon Fulford has raised his hand again since I went to him before. I will try to do that. So Simon Fulford. Wait, something is happening. It's just not allowing me to do it. So sorry, Simon. Let me try that again a little bit later. Terry, I don't have anything besides T-E-R-R-I. Great, you've unmuted yourself. You are on.
Hi, I'm Terry Kramer from Lake Oswego, and I have noticed that a few of the sort of regular homeless folks that hang out in Lake Oswego don't really have any place to go. They used to go to the adult community center, and they used to spend a lot of time in the library, on the internet, and using bathrooms. And now that the parks are all closed and the restrooms are closed, I just worry that they don't have a place even to, you know, use the bathroom or wash up a little bit. And I'll take my concerns to the city, but I'm just wondering if the county has any thoughts on how to alleviate that.
That may be something we'd want to talk to our Parks Department about, and I'm not sure if we can open up facilities in the parks sufficiently enough to also be somewhat supervised, but we can at least ask the question. And I know staff are listening to this conversation, so I'm sure that note has been taken.
Mr. Fischer.
Yeah, this is a concern countywide, and I'm really glad you brought it up because we do have coordination with our cities. And so this is a very good topic to bring up countywide with our different jurisdictions that run parks programs to really problem solve the issue. I know I live in Lake Oswego, and I do a walk along foothills, and there is a restroom there that is closed and locked and can't access it. So I definitely know that'll be a problem for those that are unsheltered at this time.
Yeah.
I do know that Oregon City has a program. They've put out portable toilets, and they've been doing that for at least a year or more. That might be an option we should be looking at also.
All right. Thank you both for that. And Vahid, did you want to say?
Yeah, just to add to that, what Commissioner Humberston just said, through the Emergency Operations Center, we have placed 6 portable toilets and hand washing stations in the county. I don't have the exact locations off the tip of my tongue, but I'm asking operations for that information right now. But that is information that can be obtained from the Emergency Operations Center. And access to hygiene facilities like restrooms, Terry, is very high on the priority list at the EOC. We're working on this.
Okay, very good. Thank you, Vahid. Oh, okay. Next, we are going to go to Brenda Kinoshita, maybe. Let me see if I can get that right. Great. Brenda, you are on if you wanted to go ahead and ask a question. Oh, Brenda, we can't hear you, but it shows that you are not muted. So maybe there's something on your end with the microphone. Yeah.
Can you hear me? Hello?
Can you hear me now? Yep. Go ahead. Thank you very much.
Thanks so much. I'm from Clackamas Women's Services, and I had a question about seeing if we can get more flexible resources to extend hotel stays. For example, it seems to be taking people longer to get housed if we have housing vouchers for them. So we need to keep them in shelter a little bit longer. Can there be some flexible funding for that?
Go ahead, Commissioner.
So Brenda, are you talking about getting people out of the transitional type of housing that they're in on an emergency basis?
So more in emergency shelter than transitional housing, but can be both, certainly.
So you're looking at more flexibility for, say, rapid rehousing, getting people to housing and support services that they need to stay housed?
It's more getting into housing. That's the challenge, because the process takes just longer now than it used to, for reasons that we could have predicted and reasons that we can't predict. So we're having folks bump up against what is the standard stay in emergency shelter. And so if we have a way to move funding around so that we could extend a stay in emergency shelter and even in transitional housing, until, once they've found a place to go, but maybe can't get into it just yet.
Okay, well, that might be something that Jill can respond to. Yeah.
Yeah. So I appreciate this information, all this information that's coming in about need. Fahid and I are noting it all down. We just had a conversation about resources and trying to identify priority needs, and you're doing exactly that for us. So we will do what we can to make shifts, to be more flexible, and to direct funding based on what we're hearing. Thank you.
Thank you.
Yeah. Oh, go ahead.
I was just going to say that when we see the CARES funds finally get down to the ground level, that may also help give us some funding to move this along. That's a big part of the problem, quite frankly. The county's resources are limited, but hopefully the CARES funding will get released fairly quickly from the federal government.
Well, and I just wanted to mention, I had the privilege of sitting in and listening to the Continuum of Care Committee, and it was really mind-boggling to me is how many restrictions and barriers there are based on funding stream and how hard it is to get certain things that you need. So your comment about flexibility is really critical, and Jill works really well with us, as well as Vahid and Rich Swift as commissioners. If we need to advocate at the state or federal level for more flexibility for certain things, everything is being noted, and we are working on those things as they become, as it's appropriate. So thank you for bringing that up.
Okay, great. Thank you very much, Brenda. Appreciate that. Next, we are going to bring in Michelle Veenker. I'm going to say maybe it's Michelle Veenker. Michelle, if you're there, if you could unmute yourself. We're still have you on mute. There we go. And now if you could give your name and your area, and let's see if you come through. Oh, not hearing anything. So, but I can see you're unmuted. If you can give it one more try. Oh, I think we lost her. So, okay, we'll go on to Brian. I'm going to say it's Brian Marr. So, Brian, if you can go ahead and unmute yourself. I still see you. There we go. And then go ahead and give your name and your area, please.
Yeah, good afternoon. It's Brian Maher.
Maher.
I'm on the board of directors for a couple of nonprofits, both Clackamas Women's Services and Clackamas Service Center. And you've heard both from Melissa and Debra, but my concern is, yeah, with the high unemployment anticipated, you know, our nonprofits, we only have a little bit of reserves, and so we're probably going to need more support on that. And so I'm just curious if there's anything in the plans for additional support, or if there's part of the CARE funding package that can help our nonprofits out. And we're just going to see a huge spike. You know, we're trying to do delivery service there at Clackamas Service Center. And then, of course, Clackamas Women's Services is, we have a lot of need there for advocates there as well. So we're just going to get pinched on the, you know, the reserve side and the money side of it. So just not sure if there's anything in the works to help us out. And that need's going to come, you know, probably in, you know, 30, 60 days type thing. So again, I want to thank the commissioners and the team for listening and for your help in the past as well. So it's just a bit of a crisis right now. So thanks. And that was my comments. Yeah.
Thanks very much, Brian. Commissioner Fischer. Oh, you're muted, Commissioner Fischer. Good, unmute yourself. Yep.
So Brian, just real quick, not sure about all the details, but I do know that there are loans through the CARES Act, the federal government, for small businesses and nonprofits that my understanding is that they will be forgiven if there aren't layoffs. I don't know the details, but I do know my husband runs a nonprofit theater company. He applied for his loan today. So there are 3 lenders in our area, and they're accepting applications. So I encourage you guys to get in the queue to get that support.
All right, excellent. Okay, next we're going to bring in Angela Palacios. Maybe that's how to say it. Okay, Angela, if you are on, if you can unmute yourself on your computer. I have you still as muted. I cannot unmute you if you're still there, Angela. You need to unmute yourself. Otherwise, we will go to someone else for a little bit. Okay. Okay, I'm going to bring in Michelle. Michelle, if you can go ahead, and you are unmuted, but if you can go ahead and give your name, and hopefully we can, we'll be able to hear you. Michelle, are you there?
I am.
Great.
Hi, this is Michelle from NAMI Clackamas, and I have to apologize. I was actually accessing this through my work computer remotely, which can't hear me here at home. So anyway, there's not been enough mental health housing at all levels in the best of times, and that's available has been notoriously hard to get into, even before COVID-19. Getting evicted due to one's mental health symptoms, and that's in private as well as county-run housing, has always been a problem. And finding the alternative housing once you are has been a constant issue. So I have 4 questions. What is being done to make sure that people are able to access vacancies in the mental health specific housing while still keeping current residents and staff safe? And are people who are being evicted for cause based on what may be mental health issues covered under the moratorium on evictions? And how is this all supposed to expected to impact the creation of new housing that we're all so anticipating and hoping for? So I guess that's 3 questions.
Would anybody like to tackle that? If not, it's okay. Oh, Jill, here we go. Go ahead.
People that are being evicted for cause due to mental health issues, I think are covered by this moratorium. I've asked that question myself to legal aid and been told that yes, they are covered. As far as this impacting our development of affordable housing, it might slow us down a little bit, but we're moving forward full speed ahead. We've got a lot going on, and we have every intention of moving this. I think it's needed more now than ever.
Commissioner Humberston.
Just so that people know what's in the queue on that, in Milwaukee, we're going from 200 to 600 units of housing at the location in Milwaukee, and that's going to be going forward. There's 212 units on Audi that will be coming online in the very near future that are almost done in construction. Recently, 24 units of veterans affordable housing for the veterans families in Oregon City came online. And then in the planning for Oregon City up on the Holcomb area, they long-term intend to add more units there. So with the funds from the Metro bond passed, I think it was last year, we're looking at a commitment of about 812 units from that funding stream. Frankly, the faster we can move on that in terms of the economic benefit overall in the community will be a plus, because we're going to need to get people back to work as soon as possible in every industry that we can. So this actually will be a double-edged positive sword, if you will, in terms of housing more people as well as putting more people back to work.
Okay, excellent. Thanks very much. I'm going to take this time to remind our attendees that if you would like to make a comment or ask a question, you can do so by utilizing the raise hand feature on Zoom. That could be at the top or bottom of your device with the Zoom bar, depending on what you're using. If you're on the phone, I see we have 11 total phone call-in listeners. You can hit *9 if you're on the phone, and that indicates to us that you have a comment to make. So again, the You can hit the raise hand feature, or you can hit *9 on the phone. With that, I'm going to go, well, he's nothing if not persistent, but we'll see with Simon. Simon Fulford, we'll try this last time. Simon, I think you're unmuted now, but it depends on your device. Go ahead and say. Okay, there we go.
Can you hear me?
Yes, we
can.
can.
Thank you. Sorry.
Go ahead.
I'd lost connection earlier on. Sorry about that. Simon Fulford, Parrot Creek Child and Family Services. Definitely echo most of the sentiments and questions and concerns of everyone that's spoken before. And I guess sort of two thoughts, kind of questions. One is, I really do support that notion. We're in a crisis right now, but there's a huge amount of pent up need that's going to get hidden in this crisis that will hit us like a tsunami once we're over it, whether that's unreported domestic abuse, child abuse, all of those needs, mental health concerns. So as much as we can be responding to the crisis now, we need to be putting in place how we're going to respond to an even greater need than it was beforehand. And we're going to have to make sure the system's ready for that. The other kind of more immediate, I don't think anyone has any immediate answers to this, but to whatever ways the county and the county commissioners can help. A lot of this is we're providing in the nonprofit sector are really the kind of next level of essential services after health and the sort of responders. We're keeping children and families safe in housing, in congregate care, whatever it might be. And none of us have any, my internet connection's unstable, none of us have any of the protective equipment we need if and when, and it's the when.
Lost it.
Oh, Simon, you just cut out. I'm not sure we can, I'm not sure we're gonna get you back. Would anybody like to comment on what, oh, you came back just a second. If you wanna go ahead and end your thought real quick.
Just that need for a lot of these kind of second tier essential services to get access to protective equipment and the kind of some of those medical supplies so that we can protect our beneficiaries and our staff to continue those services when people do get sick, because they will.
Okay, thanks very much for that. Yep, go ahead, Commissioner Fischer.
Simon, I have this concern as well. As you know, my daughter is in an adult foster care home, and I went through with her foster care provider their emergency protocols in case someone gets sick, because they don't have all the protective equipment that they would need either. And these are very vulnerable people that need, hands-on daily living assistant care, very close. You can't remain 6 feet from these people. And it's really hard because there isn't enough personal protective equipment. It's something that we hear about all the time. So I would say get yourself in the queue, continue to raise the concern, continue to bring it up with the Oregon Health Authority, and let's keep our fingers crossed that you don't have an emergency and a crisis there at Parrot Creek, but know that the emergency operations center is there and available to help. And I think we're just at a point where the limited resources that are there go to those that are most need. Right now, thank goodness, you're not at the top of the list of being in the most need, since you don't have anybody that's sick there, but that could change very easily. And it's just all those little protocols that are in place, no visitors, no people from the outside. I know in my daughter's foster home, anybody that ever goes outside the foster home, if they come back, they have to wear a mask. There's all these precautions that have gone into place to keep those people as healthy and safe as possible.
Commissioner Humberston.
Yeah, so Simon, I'd encourage you to contact EOC to see what might be available. My understanding is they did get a tranche of PPE material in the other day, and that they were inventorying it with the intention of getting it passed out. I'm not sure entirely what the priorities are for what they got. My suspicion is it's going to be hospitals and other immediate providers of care, but you should at least check in on that. And we understand that there is stuff coming from the feds also, but it hasn't arrived yet. That's the best we've got at the moment, but definitely call EOC, and Dylan will repeat the number again before we get off the air.
I'll say it right now. The EOC, you can contact them at 503-742-5300. Again, 503-742-5300. And you can always get that information at clackamas.us/coronavirus. So thank you very much for that. We're going to go to a couple calls on the phone, but first I'll just remind people, if you have a comment, go ahead and hit your raise hand button, or if you're on the phone, it is *9 to let us know. So the next person I'll bring over is caller from the first 6 digits, 503 and then 956. 503-956. You can go ahead, you are on.
Hi, this is Kathy Heisey I'm a counselor for the city of Milwaukee, and I just wanted to say that I really appreciate that you're doing this, and I know that these calls are being recorded. I would love to be able to share them out with other people who would be interested in these discussions. I don't know where that is on the website. So if you could make that publicly available, I'd really appreciate it.
Sure, I can chime in on that actually right away, because the session that we're having now, as all of the listening sessions for the commissioners are archived to our YouTube channel typically by the end of the day. So if you just search Clackamas County in YouTube, it comes up. Our video staff does a bang up job. So
great. Thank you.
Thank you. Okay, another call for the phone. Another comment from the phone. Caller, you're at 503-786. So 503-786, if that is your number, then you are on. Please go ahead.
Good afternoon, commissioners.
Yep, you're on. Go ahead. What's your, if you could give your name, yep, your name and your area.
That's great. This is James and Harry calling from my home in Milwaukee. First of all, thank you for taking the time to hear the thoughts and concerns of county residents. The effects of the COVID-19 virus on the health and well-being of the peoples of the world is staggering in scope. Not only will health and welfare initiatives tax our resources and creativity, the economic impact will severely affect the stability of safe, secure housing for many in our local community. The unemployment of numerous low-income and housing insecure people will last long after a vaccine is available to stop the spread of COVID-19. My fear is it will take years before our economy assumes some sense of normalcy. While moratoriums on evictions will not last indefinitely and job recreation will take time to implement, many will suffer uncertain about their futures. On February 25th, 2020, Clackamas County Commissioners heard a presentation from Business and Community Services Department representatives regarding properties in the county that could be sold at auction. The 13 parcels defined in Attachment A represent a total of $817,676 if sold at the minimum bid amount. In the policy session worksheet, executive summary, it's clear that transfer or distribution of the properties is distributed to county departments, agencies, local governments, and special districts for, quote, consideration of the suitability for public benefit or affordable and low-income housing. The final paragraph of the summary states none of the properties offered on our property distribution list have been requested or fulfill the current need of these departments or agencies. The policy session worksheet specifies that property disposition is planning for an auction in the spring of 2020. And to conclude, I assume this tentative auction of properties has been postponed due to present circumstances. And yet I wonder if county administration could consider the steps necessary to utilize the sale proceeds in a manner that could mitigate the loss of housing for vulnerable residents in the county. I speak as a member of the Clackamas Housing Team, Safe Overnight Shelter Committee, and homeowner in Clackamas County. Thank you very much.
Thank you. Commissioner Humberston.
Yes, I simply asked Jill and Vahid to check into that, probably with Rick Gruen, to see what we can do, and obviously with Gary Schmidt. That's not a bad idea. That might get us a few more dollars to help a few more people.
All right, very good. We've got about 10 minutes left. Again, if we have still about 70 attendees on, if you're on the phone and you would like to make a call, if you have a phone and you want to make a comment, just go ahead and hit *9. Or you can raise hand if you're watching us through Zoom. I think Debra Mason has gone ahead and has another question, or at least still has her hand raised. So Debra,
Yes.
are you there?
Yeah, hi. Thank you for letting me speak again. I just wanted to say thank you to the commissioners for having this call and organizing it and listening. I also want to say a really big thank you for the work that's being done getting some of our most vulnerable unhoused folks into motels right now. That's really going to make a huge impact, and it makes it really easy for us to get food to them too, so that's good. I also just wanted to ask, and what can partners like CSC and other folks in the county residents, what can we do to support the county's effort right now? What would you like to say to us of how we can help you?
I would defer that question again to Jill and Fahid, because they're closer to the boots on the ground.
Jill or Vahid, do you want to offer? Yep.
I would say let us know what you need, Deborah, and let us know what your barriers are, what's making it hard for you to serve people, and keep doing the work you're doing. I think we need nonprofits in the community doing this work. You know, the folks that have the highest needs, and we need to make it easier for you. So
okay, thank you. Thank you so much. And one thing to add, during this call got some intel that sweeps have stopped.
Oh, good.
What has stopped?
Sweeps. People are being allowed to stay where they are currently.
Oh, sweeps. Got it. Thank you.
Yeah.
All right. Thank you very much, Deborah. And we have one more comment. Again, if anybody else has a comment, please raise hand or *9 on your phone. And this one is also from, I believe we've heard from the person before, Dylan C. Although, yep, Dylan C, if you could.
Yeah, me again. I'm Dylan Cromartie at Northwest Housing Alternatives.
Thanks.
I wanted to just acknowledge what I've seen working in case management with individuals recovering from mental illness. There is, given that mental health agencies are no longer doing in-person visits, there's been a lot of difficulty around people getting, their case management visits, their human interaction, obviously, in a lot of cases. Also having trouble with getting medications in a timely manner, because oftentimes clients would be responsible for going and picking those up when the offices became closed. That made things tight for the staff at those agencies who weren't even able to have direct communication anyway. So that has been an issue. And then on top of that, the food banks have been absolutely necessary. Now that the shelves have been ransacked of anything that was affordable, oftentimes clients of mine have been trying to buy food and end up buying the organic versions of everything, et cetera, because they can't find anything else. And I know that one client, even today, who had expected a food box, isn't able to get it because, of course, the need is so high, and so the amount of food boxes that were able to be dispersed didn't meet his need, weren't able to get to him. So I'm working with him to figure that out. But I know that food insecurity has become huge in this situation for various reasons, as has actual human interaction for anyone really, but especially for individuals who need case management.
Okay. Thanks very much for that, Dylan. Appreciate that. And we do have, a couple more people have, I think we can get in a couple more people before we time. First one is from Seth Lyon. Seth Lyon, if you could go ahead and unmute yourself. There we go. And go ahead and give go ahead and give your name and your area, and you're on with the commissioners.
Hi, this is Seth Lyon with the Oregon Department of Human Services. Thank you, commissioners and staff for holding this call. It's been great. Just since food insecurity came up, we have our offices are open. We are doing a lot of SNAP benefits and have had a couple of federal waivers to allow those who are on benefits starting April 1st to continue on them without having to do anything to renew. And so just, we have done almost 2,000 applications in about 2 weeks, which is about 2 months worth normally. And so just want to encourage that we are open for business. Our offices are open, but we want to do everything we can by phone and by online application. And so any agencies or anybody out there, welcome to reach out to us and help us make those connections with people that need technology because they're houseless. They may not have access to the usual technology. We want to work with you in any way but having them come in, but we are still open if folks need to. The other thing is we've picked up the free food market that the county has been doing down across at Red Soils over at Beaver Creek, and that'll be starting this Tuesday and every Tuesday, in addition to the one we have at North Clackamas, which I can't remember the cycle for that. So we're doing everything we can to be supportive, and we're going to be open for business for better or for worse. So thanks so much for everything everybody's doing.
Thanks very much for that, Seth. Appreciate that. And our other commenter has lowered their hand. So unless there are any last call, oh, nope, there we go. Oh, Vahid, did you want to go ahead and respond to that? That's fine.
Not so much directly to that, but thank you, Seth. But what I wanted, since Seth was offering a resource, I wanted to mention, since before we end the call, if you are experiencing homelessness or housing instability and need to reach out to the county about accessing shelter or services, our coordinated housing access phone number is 503-655-8575. You can find us online Googling Clackamas Coordinated Housing Access or call that number.
Thank you, Vahid. Thank you very much for that. So I see we do have a couple last second calls. We've got time. I'm just going to go ahead and ask the individuals to speak a little bit quickly. Lisa Lieberman, you are on now. So if you could go ahead and give your comment.
Can you hear me?
Yep, go ahead, please.
Oh, good. Okay. I'm actually calling as a citizen, and I want to say shout out to Sonya because she's a dear friend, but I'm also a social worker in the community. But I'm wondering if we could somehow get some information about the nonprofits on the ground that need donations the most, that are serving the most people, where we're gonna, if we want to give some money to help, where are we going to get the most bang for our buck to help the most people? And I don't expect you to answer that right now, but if there's some place that could be posted, maybe on nextdoor.com, it would be really helpful to have some guidance about that.
Okay, very good. Thank you very much for that, Lisa. And then I think we do have time for just the one more. And the person's name is Bree Sagdal. So Bree, if you could go ahead and unmute yourself. There you go. And
hi, thank you. Yeah, Brianna Sagdal. So I just have a quick question regarding the health side of this, and if there's any current conversations about titers antibody testing. Really like to get a better idea of where we're at in terms of who's already had COVID-19, and just get some better data and better testing, figuring out who's had it, who has not, who's at risk, and just a clearer picture of where our numbers are at. Hoping to get any information about that, and if there's been any conversations about that yet. Again, antibody titers tests. Thank you.
All right, thank you, Bree. One thing I'll say to that before anybody has any comments on that is that you can always call, again, the call center with that. We operate out of the Emergency Operations Center at Clackamas County. Again, that number is 503-742-5300. There's a public information center there that is taking these calls, I think most working hours for certain, and you can also go there at clackamas.us/coronavirus. But I need to jump in if any commissioners or Jill or Vahid has anything to respond to that. Go ahead. Okay, well I believe that is it. We are at 3 p.m. Commissioners Humberston or Commissioner Fischer, if there's any final thoughts you would like to give, please feel free.
Yeah.
Commissioner Fischer, I was going to say, Commissioner Fischer, go ahead.
Yeah, I just want to thank everyone for participating. This information is so important, and please, doors are open. I know I can speak for all the members of our commission. Please reach out to us. You can reach us generally at bcc@clackamas.us, or you can call the office and we'll get your call. The county is operating. Many of us are working remotely, but we are here and we want to hear from you. Please keep in touch. It's how we can do the work the best, is by hearing from you.
To the best of my knowledge, to the last caller's question, the state is not releasing information as to who or where the people who have been victimized by this virus are. So that still remains confidential to the best of my knowledge. As far as testing is concerned, only those, again, as far as I know at this time, the people that are tested are either people who show symptoms of the disease or people who are working with people that show symptoms of the disease, to make sure that they're kept safe. We don't have sufficient testing facilities at this point in time. We are still awaiting that from the federal government. And so hopefully that won't be too much longer before we get those and we can do more testing. On a final note, the governor less than 6 months ago was asking at least 250,000 people to have 30 days worth of food supplies in their home, along with water, in case there was a national emergency or a local emergency, such as a subduction zone event, a major earthquake. Well, this is a good example of the kind of event that it still would be appropriate. If this particular disease follows the pattern that the 1918 flu epidemic followed, it may fade out in the summertime and then come back in the wintertime. So I would like to encourage people to make sure that they can have several weeks worth of food and supplies in their home, because if we have to go through this again in the wintertime, the more you can stay home and the less interaction you have with others, the safer all of us will be. We'll leave it at that. We don't know what's going to happen this winter, but be prepared for that possibility. And I really want to thank people for tuning in and listening. We will do the best we can to make sure that people are as safe as possible and that those that are most vulnerable are cared for. And Dylan, I want to thank you and Jill and Fahid and my colleague Sonya for putting this all together.
Excellent. Thank you very much for that, Commissioner Humberston, and thank you, Commissioner Fischer. And as Commissioner Humberston said, my thanks to Jill Smith and Vahid Brown from the county's Health, Housing, and Human Services Department for joining us today. This session will be archived on the county's YouTube channel, in all likelihood by the end of the day. I want to thank all the attendees that we had. We had, I think, a high point of about 75, which is great. This is just the first week of Commissioners' listening sessions. We are continuing this next week. I'll go ahead and note that the next one, we will have details about it on our website, probably by end of day tomorrow, but it is on just overall the county's response to COVID-19. That is going to be with Chair Jim Bernard, County Administrator Gary Schmidt, and Disaster Management Department Director and EOC Commander Nancy Bush. We will also have another one a week from today, topic to be determined, but based on the turnout, certainly there's community interest for this, and we've had a lot of great conversations. So for Clackamas County, I'm Dylan Blaylock. Thanks very much for joining us. We'll see you next time.